Hi, I'm Melissa Fuller with Shape of the City. I am here with Dr. Dave Myers with Bryan Health. We are here to talk about HopeLNK. Can you tell us a little bit about HopeLNK and what it is, how it got started, and a little bit about it?
Absolutely. HopeLNK is a website that the Lincoln-Lancaster Suicide Prevention Coalition put together with the help of a grant. The State Suicide Prevention Coalition worked with the state of Nebraska and wrote a federal grant called the Garrett Lee Smith Grant. And that grant pulled in money from the federal government to focus on youth suicide prevention. And so the local Suicide Prevention Coalition here in Lincoln wanted to focus on youth suicide prevention and reach our youth using technology, but in a way to bring our community together and have kind of a one-stop place for everybody to go to start a conversation about suicide prevention. So we thought of the idea of HopeLNK with the help of a marketing firm, and so it's HopeLNK.org, and it's basically starting a conversation. And it helps individuals start a conversation about mental health, because it can be hard, it can be a difficult conversation to have, but it's okay to have the conversation. You know, there's a myth that says if we talk about suicide or if we talk about mental health, but specifically if we talk about suicide, is it going to give somebody the idea? Absolutely false. The best thing that we can do is to bring it up, and by bringing it up, that brings up hope. That gives hope, that gives inspiration, that gives that individual the opportunity to share what's going on with them. Then you can connect them with resources. So HopeLNK is a way to start that conversation and to get folks connected to the resources that are there or that are here in our community that we have to connect folks to services.
Can you talk a little bit about the urgency of something like this? Why is this so crucial, especially for youth right now?
Suicide is one of the leading causes of death for ages 15 to 24 in Nebraska, but across the nation. And so suicide is something that we need to take very seriously. And so if you know somebody who is suicidal and they're in crisis, we want you to call 1-800-273-8255, which is the National Suicide Helpline, right away, or go to your nearest emergency room or call 911. You know, get help right away. But if you know somebody who's suicidal and it's a non-crisis, and you're wanting to start that conversation and find out if it is a crisis, then going to that website, HopeLNK.org, it connects you to other sites and other resources to help you start the conversation and how to get them connected to individuals to find out if those signs and symptoms are there. There's also a link on the website that takes you to a depression screening tool. 90% of those who die by suicide have a diagnosable mental illness, most commonly depression. So if we can get folks to go take an online depression screening tool, for youth, there's a tool on that site that the parents can take. And they take it based on what they notice the signs and symptoms on their youth. And then that tells you whether or not, okay, the signs and symptoms of depression are there in my youth and I need to take the next steps. So there are tools within the website that are built in to help you find out if the signs and symptoms are there.
Can you tell me a little bit about some of the other partnerships that were involved that are sort of collaborating for this website?
Absolutely. The Lincoln-Lancaster Suicide Prevention Coalition was an effort that started approximately 2014. Superintendent Dr. Joel from Lincoln Public Schools decided that, you know, we need to do something as a community. You know, we had the State Suicide Prevention Coalition that I helped start back in 1999, but the local coalition started in 2014 and said, you know, Lincoln Public Schools will be kind of the host site for the meetings, but let's pull together folks from across the community to start meeting. So, you know, Bryan Medical Center, businesses from across the community, suicide survivors, meaning individuals who have lost somebody to suicide, public school, parochial school, people from all over have come together, have come to the table over the last 4 or 5 years to help us start planning and putting the pieces together to develop goals to say, what are we going to do as a community to start focusing on suicide prevention in Lincoln specifically. And that's where we started focusing on, we focused on a lot of different things. The website is one of those things. And we wanted to find a way to bring everybody together as a community. interestingly, there's a research study that came out in September 12th, a couple weeks ago, 2018. The Action Alliance for Suicide Prevention, the American Foundation for Suicide Prevention, collaborated with Harris Poll, and they did a public opinion survey, and what that survey showed is that 94% of Americans felt that suicide is preventable, and that if they had somebody close to them that was suicidal, they would take action to help prevent them taking their own life. And that's very telling. And what that tells us is that specifically what we're doing with this website is very important, is that we do know that suicide is preventable, but that's overwhelmingly across the nation that individuals want to do something. And that's what we're wanting to do as a community, is we want everybody to step up, start that conversation, and to work together to prevent suicide. And we're providing the tools and the framework through the website to do that. And so if folks want to get involved, not even through just, you can go to the website and get some of the tools, but if they want to come to the table and be a part of our coalition and get involved in other ways, they can go to the website, and there's a way to link into that, put your information in, and to get contacted with one of us on the leadership team for the coalition to get involved.
Do you have any last message you would like to leave with our viewers in terms of someone who may be in an urgent situation right now? What should they do?
Well, I think it's very important to know that there is hope. There is hope. Individuals, don't be alone. You're not alone. There are other individuals that are out there that are feeling, maybe feeling the same way. And that's why it's important to start that conversation, so that we can get individuals talking and to get individuals to open up so we can understand the pain that individuals are going through. But unless we can start that conversation and get individuals to start talking, we're not going to know that. But if somebody's in crisis, we need to get them to the emergency room, to the Brian West Mental Health Emergency Room, which is available 24 hours a day, 7 days a week, or any emergency room, 911, or the 1-800-273-8255 number. Get them connected to resources as soon as possible.
Perfect. Thank you, and thank you for all the work you're doing.
Thank you.